Hi, welcome to another edition of Your Health Matters with Dr. Benjamin Bryant, Chief of Staff and General Surgeon here at UH County Medical Center. Doc, how you doing today?
Pretty well, pretty well. Boy, it's really getting down to the fall, isn't it?
Yes, it is, and I'm glad the election's over.
Oh, gosh.
I was telling Matt and the girls here that we were up until 4 o'clock this morning watching this thing, and I never have done that before because I always worked election night, so now I am free to. I was my first presidential election to watch it all the way through.
Yeah.
And
well, you know, the thing of it is, all of those political ads are going to come off the TV.
thank God.
Back to real programming, yes.
Get back to not being bombarded all the time.
I see you have guests with us this morning, Doc.
Wow. Well, this is actually kind of a landmark show for us. It has emerged when Denise was on last time with the Hospital to Home program here at Conneaut, that there is a big network of fantastic organizations out there that provide services to people of all different types. It's way beyond anything that I realized was there. And so this program sort of kicks off what these programs are, what they do, and how the Hospital to Home program interfaces with them to make sure that all of our patients have all the support they need once they get home from the hospital. So with that, Denise Brown is here, and she's the RN who works with one of them who works with the Hospital to Home program, and she's going to introduce our guest.
Thank you, Dr. Bryant. As I mentioned in the first episode I was on, when I go into the patient homes, I like to give them resources to help them not only with their health issues, but also any resources that might affect their health, whether it be finances, help in the home, prescription assistance. So whenever I go visit a patient's home, their very first visit, I like to give them an informational packet with different resources in it. And one that I always make sure I provide is the 211 pamphlet, which I'm happy to have Ms. Tiffany Reid with us today, who's from the 211 organization. 211 is a wonderful organization that has a variety of resources available that I'll let you follow up on.
Well, thank you so much, and thanks for having us here today.
Tiffany, it's really a pleasure.
Well, thank you. We always enjoy an opportunity to come out and talk to everyone about the programs and services available in Ashtabula County. I know the focus is your home program, home to health?
Hospital to home.
Hospital to home program. And you know, we have a lot of individuals who have a lot of really deep needs here in Ashtabula County. 211 is actually one of the many services offered by the Ashtabula County Community Action Agency. 211 is just our flagship program in that it is a 24-hour help and information referral hotline. It is the core program because it allows our trained and certified operators to be on the front lines when it comes to connecting individuals with the resources that they need. So,
Okay,
it's perfect for your program.
A patient gets home from the hospital, and it's 3 o'clock in the morning, and something's going on, and it's not necessarily something that they need to go to the ER for, but you know, they're having some problems, they're having some trouble. They pick up the phone at 3 in the morning. They get somebody. They get somebody,
absolutely. And I always
awesome.
like to let people know, if you are experiencing an emergency, dial 911. But if you're home, if you're with a family member, friend, or neighbor, and you come to understand that they have some needs and they just don't know where to go, you know, it's one thing to thumb through the phone book and try to figure out who you need to call. You can erase all of that. You can remove that challenge and just dial 211, those 3 numbers. You can dial 211 from any phone here in Ashtabula County, and you will be connected at any time of the day or night with a trained and certified operator who can explore a little bit with you what your needs are and what the best referral would be to connect you with resources available.
That is fantastic.
How does that work, Tiffany? Like, if you call at 3 in the morning, as Doc said, would the operator then call out somebody to help Or how's that?
So 211, because it is an information and referral
Right.
hotline, we exist to provide referrals to other social service agencies. We get those phone calls where, can I get the number to something that's not a social service
Right.
agency? And if it's appropriate, we'll make that referral. If not, we'll direct them where they can get that information. But let's assume that the call that you're speaking of is in regards to somebody needing maybe food. Maybe they came home from the hospital. Maybe they spent a couple weeks here and they got home and all of the food in their fridge was bad.
Okay.
And their cupboards were bare. The operator will work with that individual to find out where they located. Are there children in the home? And based on their location, will provide information where they can go to get a hot meal, groceries, and access to a food pantry based on their location.
Very good.
And that's just one example of the types of calls that we receive. Actually, our agency, this is what Community Action exists to do. Our mission is to help alleviate poverty and move people towards self-sufficiency. So by providing information offered through real people in real time, that's why I talk about 211 as being the core focus of what we do at our agency to live that mission every single day. While it's absolutely anonymous and confidential for any individual to dial 211 from their phones, and while we don't keep information about who calls, unless, of course, they want us to follow up with them in a couple of days to make sure that the information they received was correct and that it assisted them in getting what they needed. We do keep metrics on the reasons why people call. And historically, we have a top 10 list that helps us utilize the services and recognize service gaps. Because just as much as our agency is all about connecting people with the services that and resources that exist, our agency is also very big on behind the scenes, recognizing when service is needed. And if it doesn't exist, our agency is all about trying to figure out how to become a part of the solution and creating that program that's needed or working. And we do that a lot through collaboration and partnerships, joining with other social service agencies, community organizations, even churches, to offer that need or to offer a resource to remove that need from an individual or household. So our top 10 list changes constantly.
Could you maybe give us some of the
Sure.
current top 10 lists, or some that you're
Well, I
come
want to
to
talk
mind?
about the top 3 because although the top 10 list changes, whether or not, or depending on if the first of the month falls on a Monday or a Friday, or if there's a holiday in the month, the top 3 reasons why people have dialed 211 has not really changed in the last 4 or 5 years. So I wonder if you could tell me what you think any one of the top 3 reasons are that people dial 211.
I really would not know.
Okay. Well, that's a non-guess. Just throw something out there.
I don't.
I bet some of the individuals watching are probably thinking and saying something to their TV right now.
They probably are.
And if I could hear them, if they yelled out food, because we just talked about that, they would be correct. If I had something to give to them, I would, for winning that number 1 spot.
So that's the number one.
It is. Food, access to food, hot meals, groceries, is the number 1 reason why people
My
dial
goodness
211.
gracious sakes.
And so, you talk about some of the reasons why people experience setbacks. We talk about poverty. It's this big word that a lot of people are afraid of or don't know a lot about it. And yet, here in Ashtabula County, we are behind nationwide when it comes to catching up from the 2008-2009 crisis, the housing crisis and financial crisis. And in our attempt as a county to catch up with other places throughout the United States, food insecurity remains very high, especially when we're talking about vulnerable populations like seniors and children. And so when I was growing up here in Ashtabula County, I remember
You grew up in
I'm born and raised in Ashtabula County. I never heard of 211. I just remember being in the back seat of my mom's big Chevy Caprice. The only place when she needed assistance feeding our family, the only place I remember being able to go at that time was the Salvation Army. And I remember sitting in the back seat waiting for her to come out, and my sister and I would be there, and she'd come out with this big brown bag, and it would be filled with cereals. And do you guys remember those big blocks of government cheese? Best toasted cheese sandwiches ever, right? Best toasted cheese sandwiches ever. Maybe some powdered milk, and you'd be lucky if you had some peanut butter or an apple or fresh fruit. Today, because of the response of community organizations, like I mentioned earlier, like the Salvation Army, other social service agencies like Catholic Charities, the Dream Center, Lighthouse Harvest, we're proud to say that there are over 9 different places where when people call in for needing food or groceries or a hot meal, we can refer them to over 9 different places here in Ashtabula County where they can go to get assistance. That's powerful. That's progress. And that's right here in Ashtabula County.
You know, that says a lot about our county.
It does, absolutely.
It says a lot about the heart of the people in this county.
It does, truly,
So
truly.
you got me wondering, what's number 2 and 3?
Do you have a guess?
Utilities.
Oh, ding, ding, ding,
What do you
ding.
think?
Utilities.
Ah.
Utility assistance. So people, that is the second reason why people call. And especially at this time of the year. Ashtabula County Community Action is actually involved with, we have a housing program. So let me back up a moment, and because we're talking about 211 specifically and how 211 can connect people to referrals and assistance in any one of these categories that we're discussing. But our actual agency, Community Action, that is the parent organization, if you will. And underneath Community Action, we actually have in-house programs to serve the community. And one of those, actually, that shares a space with our 211 call center is our housing department. And in our housing department, we are responsible for providing assistance with HEAP, which is Home Energy Assistance Program, and PIP, which is a percentage of income payment plan. Both federal programs, government subsidized programs that exist to help people who have no income to moderate income based on the number of people in your household. And the assistance exists to help them pay their bills. So this time of year, we've just entered winter crisis.
So, am I correct in assuming that basically no citizen in Ashtabula County has to have a cold house in the winter?
That is correct. That is correct.
Wow.
That is correct.
I never knew
And while our agency helps to administer these government subsidized programs, it's the existence of those programs that allow people to have quite a few options in either getting signed up for utility assistance or service with the electric and gas company, so somebody will dial 211. Mr. Smith calls in and talks to one of my operators and didn't realize that he was able to qualify and be eligible for assistance with his utility bill. So we get him connected with the electric company, he comes in for his appointment, and then he finds out, okay, they said I could sign up, but now I have a back balance that I have to pay. That's the dark side of the utility service assistance efforts that go on here in the county. The beautiful thing about that, the fact that our housing department and 211 are housed together, is that gentleman, Mr. Smith, will then be referred back to one of our operators who will learn a little bit more about his situation, what his needs are, and connect him with other agencies that could possibly assist him with getting that back balance paid in order to initiate his service or maintain his service.
Okay, so he already owes the utility company for the purposes of this example. And even though he's in need and his house is cold, they can't, they won't turn it on because he has a back balance.
In some cases, that is correct.
Cases.
Correct. Because in other cases, if the gentleman, if an individual or family member is on oxygen, if they have a documented diagnosis or disability, that's why people need to dial 211, because there are so many resources that exist to help people given their specific circumstances that we'll be able to walk them through that and connect them with the proper
So your trained
entity.
operators can dig into that.
Absolutely.
And really see where everybody is.
Absolutely.
Wow, that is
it's
unbelievable.
powerful. It is. It is.
Folks,
and it
I
allows
couldn't,
us.
I'm amazed by this. This is fantastic.
Again, we talk about those vulnerable populations, and especially with seniors. You may have somebody who calls in and says, Mr. Smith, busy on the phone with us, right? But Mr. Smith calls back and says something to one of our operators like, I don't have money to pay for my prescriptions this month. I'm sure you hear that a lot, Denise, right?
Yes, that's a huge concern.
So if one of your clients was to make that call stating they couldn't pay for their prescriptions, our operators know that they probably can pay for their prescriptions, but they'll start asking other questions like, are you covered by any type of health insurance? No, why not? Did you know that you were eligible based on these reasons? Maybe it's income eligibility or the number of people in their household. And then once that person is, and we can assist any individual if we can advocate on their behalf. So especially for seniors, which in the state of Ohio is over the age of 60, anybody over the age of 60 who's unable to just receive the phone number and make the call on their own, our operators will do the work with them and help them understand their place in the process. So we can advocate on their behalf, and that could include keeping them on the phone while we transfer them over to the electric company or the gas company, helping to explain the situation of the individual we have on the line, providing that follow-up I talked about at the onset of this conversation, following up with them in 3 days to make sure that they had received some sort of resolution to whatever issue they had, and then find out also, okay, now that we helped you with that, is there anything else you need assistance with? In the case where Mr. Smith calls in and says that he doesn't have any money to pay for his prescriptions, by the time our operators get done, we know that within maybe 8 to 10 days, Mr. Smith is now covered by health insurance. He's connected with programs that can help him provide food. One of those happens to be a community action agency program called Senior Nutrition, AKA Meals on Wheels. So now he has healthy, nutritious, delicious meals being delivered straight to his home. In 30 days, he's more than capable of paying for his own prescriptions now that he's receiving additional supportive services that he didn't even know, he didn't realize that he could access.
So medication would be number 3?
Nope, and not even top 10. Number 3 is transportation, believe it or not, here in Ashtabula County.
That makes sense.
Yeah.
Mm-hmm.
But let me go back and ask a question. Here's a person has no insurance, health insurance I'm talking about, and they are somebody who might well qualify, for example, for Medicaid. Now, could they dial 211 and get assistance in signing up for Medicaid?
So, prior to, this is November, right? Election season, and clouds your memory, clouds your mind a little bit. Prior to September, anybody in the situation you just described would dial 211. When our operators learned that they were not covered by, or hadn't even probably explored being able to be covered by Medicaid or any type of insurance, we would make the referral. If they were able to make that call on their own, we would follow up with them in 3 days to make sure that they were able to get in touch with somebody at the Department of Job and Family Services to sign up for that. Where are they in the process? Do they need any other assistance? So we don't actually do the sign up at our location, but we will let them know where to go, what the hours are, what kind of documentation they need to bring with them.
This is what I'm talking about.
Absolutely. Since September, there are members of our staff who are certified in providing services under the Ohio Benefits Bank. The Ohio Benefits Bank was huge in our county probably 5 or 6 years ago. And the Ohio Benefits Bank certification now allows members of the community development team, which also houses 211, to make appointments with that same individual that you just described. So yes, we could make the referral. They could go do that on their own, or we could now bring them into our agency up on Austinburg Road, meet with them and for about an hour and take them through a series of questions and situations and let them know what they qualify for based all at one time. At one sitting, we can let them know what they qualify for based on their income and household.
I can tell you that, I see patients in my office all the time who don't have insurance or lost their insurance, and their situation is such that they are the people who are falling through the cracks that the Medicaid program is designed to catch. Okay, and it's a very daunting thing to be
Mhm.
facing that monolithic bureaucratic wall.
Absolutely.
And so some of them they say, oh, I could never do that, I don't know how to do that.
Mhm.
But if they can just dial 211 and just
Mhm.
start talking,
Absolutely.
talking, of course, the operators there will engage them.
Mhm.
And the next thing they know, they're on their way through the process.
Mhm.
I mean, I can tell you that some people from my office are gonna be calling.
Mhm.
And
Well,
there's
that's
just
great.
no doubt about it.
That's great.
Now,
I think Matt had a
yeah,
question.
Matt has a question.
What if English is not my first language?
You can still dial 211. All of our operators are trained on using our language line. So our agency is prepared to be able to receive a call in any language. And once we know what the language is that the individual is trying to use to engage with us, we will place them on hold, get somebody on the line who speaks that language, and through that interpreter, we'll be able to provide the exact same service. Somebody who doesn't speak English, that should not be a barrier to them calling. Absolutely.
Very good.
Okay. Yeah.
Unbelievable.
And we also provide the same service for individuals who are deaf or hearing impaired as well. So again, we're trained to receive those phone calls. And it's funny that you even asked that because, you know, because our operators are trained and certified, this is certification that we have to keep up on every year. We're currently in our reaccreditation phase through AIRS. And so we've recently gone over and provided additional training for our operators just to make sure, you know, if you don't get a call, a TTD call in a couple of months, you might forget this or that. So we're trained, we're waiting. Right now, I would say in regards to the calls that we receive where we need to dial an interpreter, probably Spanish is the first language that the top language that we utilize interpreters for, but it doesn't matter. Any individual who doesn't speak English who needs to dial 211, I can't urge you enough to just dial the number and we will get somebody on the line who can speak with you.
Are those interpreters local?
You know, I don't know where they're at, but I just know the phone number that we dial. We put in an access code, tell them who we are and what language we need, and there's somebody right there on the line with us in moments.
That's great.
Moments.
That's great. How long have you been doing this?
How long have I been doing this? February will be 3 years.
3 years.
3 years, yes.
You're so well versed on this. It's amazing. How did you actually get into this?
Well, although I was born and raised here in Ashtabula, I
Mhm.
spent 12 years on the East Coast. I was in New York City, South Jersey, and so the work that I was doing, I found myself impacting other communities,
Mhm.
and then it was just time for me to come home. So I came home the Monday before Christmas in 2013, and I was hired at Community Action in February, so just a few months later. And I can tell you when I interviewed, the only thing I knew about some of the programs I'm talking to you about today was off of the website.
Sure.
But it, you know, the fact that the need, like you mentioned, is so great here in Ashtabula County to
You bet.
connect people with the resources that do exist. We're always shocked at the number of people who, A, have never heard of 211, so therefore have never dialed 211, but just don't know some of the things that you know, in a building right across the street from where they live is the solution to a lot of their problems.
Well, that's one of the fundamental purposes of this show today,
And that's beautiful.
is because, you know, people watch this show, we encourage people to watch this show, and now people know about you.
Mhm.
And now people are writing down 211.
211, and we always make the distinction. We don't tell people to call 211. We tell you dial 211. From your cell phone, from your home phone, you dial 211. The beautiful thing about 211, and if I can spend just a little bit talking to you about 211, it is a national program. So this, the ability to dial 211 from a phone exists in the continental United States. If you are in Cuyahoga County, in Cleveland, Ohio, and you dial 211, 211 is actually administered there by United Way. So if you're an Ashtabula County resident and you're traveling to Cleveland to watch a Cavs game, and you have some time and you have a hands-free device in your car and you're like, oh, you know, when I get back, I really need this phone number, you can dial 211. And just because you're probably geographically closer to the Cleveland area, that 211 call center will probably take the call. However, because 211 is a national program, you just say, oh, I reached Cuyahoga County's 211, I need Ashtabula. They will transfer you right over to our department. It is just a beautiful transferring, an understanding, a contract that we all have.
We touched on transportation, and we know a lot of seniors that do not have ways to get around.
Mm-hmm.
And we are kind of limited here. We do have ACTS, right?
Yes.
Are there any other options?
So the beautiful thing about ACTS, which is an acronym that stands for Ashtabula County Transportation System, is that they have 3 loops that serve the majority of Ashtabula City and like the townships, the township areas. So they're pretty specific in who they are, the geographically speaking, who they can serve. So let's start with South County, because we talk about South County and I feel like we're talking about a place that's 100 miles away. And sometimes it can feel like that, even though you drive 15 minutes south and you're in South County.
Right.
There, where ACTS can't, the actual ACTS buses that we're used to seeing providing services in Ashtabula City, while they can't really navigate in their schedule and their offerings in South County, they have partnered with Country Neighbor, which is another amazing organization that exists in South County. So Country Neighbor provides additional transportation services as an extension of ACTS to our South County neighbors. They also provide food assistance and so many other just neighborhood programs that positively impact the individuals living south of us. Here in Ashtabula City, we have an organization called Faith in Action. And Faith in Action, a lot of people haven't heard of this either. It's a volunteer-based transportation program. It's a nonprofit that, through the efforts of volunteers who sign up to provide rides to people, do exactly that. So somebody can dial 211, talk to our operators about the need for transportation, and our operators are going to find out a couple of things. They're going to find out if the need for transportation is recreational, if it's due to a medical appointment. Maybe they have to come out here to UH here in Conneaut.
Can I pick up on that for
You
just
sure
a second?
can.
Here's a patient who has a situation where they're going to have to be seen by, for example, UH's East Side Regional Center, if you will, which is in Geauga. Okay? And so they have an appointment, what they're going to need an appointment with a specialist in Geauga. Okay? And they can't get there. Can they dial 211?
Yes, they can. Yes, they can. And when they dial 211, we will explore the options, what their needs are, where do they need to go, who are they already working with. Because a lot of people don't know that if they have appointments with doctors at UH here in Ashtabula County and with the Cleveland Clinic, each of your entities provide transportation assistance for those appointments.
Right.
People don't know that, so we educate them about that.
That's great.
We then provide them the phone number to ACTS, because while ACTS has a regular bus service where there are routes that start and end at certain points at certain times for a certain fare, by dialing ACTS, by our operators at 211 connecting that caller to the ACTS service, those ACTS operators are trained and they have other programs to assist individuals based on their individualized needs as well. So if they have a medical program or a medical need.
If they had to go out of the ACTS service area, for example.
If they have to go out of the ACTS service area, ACTS will let them know what's covered, where they're able to take them, and how they're able to get them there. And that could include an ACTS bus, or it could include a ride through city cab. ACTS has their own contracts with other transportation providers to assist individuals in Ashtabula County. Now, if there is a gap where ACTS or Country Neighbor or one of the hospitals can't serve an individual to get them where they need to go, then our operators would instruct the caller to call Faith in Action, because those volunteer drivers take individuals, especially 60 and over, or any individual who's disabled.
That's who it usually is.
And they exist to fill in those gaps after all of these other options are explored. So a lot of the volunteer drivers at Faith in Action use their own gas and their own vehicle to take somebody to cancer treatment in Toledo. Maybe it's in Sandusky. They can do that.
So
because
they could certainly go to geography.
absolutely, absolutely.
legally.
So if you notice, unlike some of the other services that exist, to meet a need, when it comes to transportation, it truly takes a village. And
Is there a fee for that, Tiffany?
is there a fee for?
Say if I need to meet a ride,
Mhm.
do I have to pay anything? And if not, how do you fund it?
I think it depends on the type of insurance that you have. ACTS, when we make the referral to ACTS, we don't determine the eligibility of the clients. ACTS does that. And then they also, because each client, each individual caller is so different from the next. So
Right.
ACTS will go over eligibility requirements, any type of cost associated with that ride. ACTS will do that on their own. When it comes to Faith in Action, there is no cost for providing that service to those seniors who need to get out of the county.
And I'm certain if Axe has to use the cab service, I'm sure there's a fee with that.
And I also think, though, that there are provisions in place where ACTS, the medical provider, and the insurance company will all work it out. So before the individual is picked up, the individual, the transportation provider, and the insurance company will know what the cost ramifications are to all parties involved. Our operators know to make that referral. And again, although some people may say, well, all you're doing is telling me to call ACTS, that person may not have known to do that. They may not have known that ACTS can step up and really take them through some other options, maybe that they didn't know about.
Oh, yeah.
So transportation is the number 3 reason why people call
Excellent.
211. So
Excellent.
yes.
Wow.
Mhm.
I like Doc said, I wasn't aware of a lot of this,
Mhm.
maybe
No.
all of it,
Mhm.
you know?
Yeah,
so-
this is spectacular.
Yes.
Yeah.
Yes.
Yeah.
It's just people need to know about it.
Mhm. Absolutely.
Now, another area of concern that I find a lot when I go in the home is people are okay living on their own, they just need that little extra assistance with light housework or handyman
Mhm.
chores around the home.
Mhm.
And what kind of services can you connect them with in regards to that?
So, earlier I talked about how wonderful our program is when we can make a referral, right? So, the entities that exist in our 211 database, the lists of vendors that come up when we type in food or housing or transportation, they exist there in our database for a reason. Just like any policy, we have one. Just like any service, we have a policy that guides who can be included and who should be excluded from the list of providers that we make referrals for. So, and that helps. The goal of having that policy is to really protect the consumer, to protect all of you dialing 211. So a lot of people will call in and say, I need information for my mother and father about nursing homes. Well, nursing homes are for-profit entities. We are not going to be able to make a referral for that. We can talk to them about where they can go to get information about that, but we aren't going to be making referrals for individuals, for entities that are going to charge somebody something.
But you can, as you just said, you can direct them to a resource that will explain to them what is available.
Absolutely.
You can't do it, but you can show them
Where
who
to
can
go
do it.
to get the information.
So they're not stuck.
Absolutely. Correct.
They don't
Correct.
get a dead end.
When it comes to handyman services and kind of those household chore services,
Mhm.
I can tell you that we get a lot of those phone calls. We get a lot of those phone calls. And, whether it's, we had an older woman call in. She's housebound. She hadn't left her house in I don't know how many years for whatever reason. Her family purchased new carpet for her. And in order to get that carpet installed, all she needed was somebody to move the dining room table out of the living room so they could install the carpet. So she called 211. So it's not our policy to refer her to a handyman or a contractor because we haven't done our due diligence. It's for a cost, so they wouldn't be included in our database. And there's no way for our agency to do any due diligence regarding the professional reputation of any of the contractors that we might know personally, but may not be able to, recommend in that regard. So unfortunately, we weren't able to make a specific recommendation for her to say, oh yeah, call Jimmy, he'll come over and, help you move the table real quick. We can't do that. But what we are able to do is connect that caller with entities that exist who have a history or experience providing these types of services. So in this regard, in this case, we were able to make a referral to her to LEAF, which is an entity here in Conneaut actually, that looks for, at certain times of the year, they look for either large projects or individuals who can benefit from their pool of volunteers who will look for a list of, oh, Mrs. Smith needs her dining room table moved, let's call her and see if she can wait until we have our big blitz and go out and do that. We've had people call to say, I have a tree that came down, I need it cut up. These are the types of referrals that we make to these other entities who aren't really social. They don't necessarily identify themselves as social service agencies, but they are community organizations, church groups who are in our database because of the free volunteer service that they can provide. So LEAF is one of those entities.
It's big here.
Yes, Habitat for Humanity. Even H2O, which is an organization that's been around for a while, they all act or provide services at different times of the year to different populations. So really that's what we're able to do. And I talked about identifying those service gaps as well as making referrals. And behind the scenes, our agency is keeping an eye on this, because only when we know the number of people or households or families that are being impacted by our agency or 211 not being able to make a specific referral for that need, can our agency then partner with other people to say, okay, in 2016, we had 10,000 people call in for a tree that needed to be moved, or a dining room table that needed to be moved, or a step that needed to be repaired. And then we can now look for funding and partnership and collaboration to make that a reality for 2017. So,
Fantastic.
yes.
Wow.
We're constantly gauging the needs of people. So if we can't make the referral, we're looking as an agency to see how we can become a part of the solution.
Good stuff.
It is. And I would be
Absolutely
remiss.
amazing stuff.
I know a lot of the programs we've talked about are dealing with the populations that you're serving. But community action, I mean, in serving their mission of moving people out of poverty, it's really connecting all groups of people, all types of people with programs and initiatives to better every household's life. So I mentioned Senior Nutrition Program, AKA Meals on Wheels. We also have WIC, Women, Infant, and Children. And we have a health home program where trained and certified teachers go out into the home and help prepare moms and dads for bringing baby home. We have Head Start, which really threw me when I moved back. I was learning about Head Start, and they kept talking about, 0 to 5. I'm like, 0 to 5? How is a kid 0? I didn't get it. But again, it's part of that that Help Me Grow program that goes out and trains parents how to prepare for baby. So that's the 0 part, and how to prepare their home so when baby comes home, there's a healthy environment, and that mother and father and maybe other siblings can be more engaged in getting this baby off to a great start.
Well, that has to be a tremendous confidence builder for you.
It really, I hear some of the testimonies that are posted, and just meeting some of the families out doing the outreach work that I do to make sure that they know that there are other programs. So as the baby or their children transition from 0, 1, 2, 3, all the way through 5, and they go from early Head Start, which is 0 to 3, and Head Start from 3 to 5, that one of the big things when helping people connect with resources or just expand their knowledge of what exists to move them out of poverty is reassuring them that they aren't alone while they're doing it. So there's a lot of concern for parents and families and households who might be only enrolled in our agency's early Head Start or Head Start program. So as their child is nearing 5, they're like, oh no, what am I going to do? I'm not going to have this extra support. I'm not going to have this. I'm not going to have that. And part of our outreach initiative is to really let them know, look, we have empowerment workshops. What is it that you need? Do you need to be prepared to get a job or to get a better job? Do you need to increase setting boundaries with family members or fellow employees or maybe your boss? Whatever it is, we have empowerment workshops in our community development program that we offer to a myriad of people.
Are you hearing this?
We serve families, we serve parents, we serve even the individuals leaving incarceration and treatment, coming back to the community. We prepare them by going over skills that they already have or had and just need to be reminded of, so that when they get home, not only are we able to connect them to the resources that help keep them home, but we're also able to provide them with the confidence and the courage to make better decisions. So we're also providing job readiness programs with the Adult Parole Authority. So individuals who, have a blemish on their record for whatever reason, they've made a mistake, they just need some help figuring out how to capture the talents, gifts, knowledge, and skills that they have on paper in a resume, and prepare to be able to have a conversation with the employer, their potential employer, to say, this is who I am, this is how I should be defined, and this is why I'm the best candidate for this job. That's what we're doing. We're helping to make positive inroads in the community, one person at a time. So we have those empowerment workshops. We have our housing department. We have 211, which is really those frontline operators who can help direct people to where they need to go to get the assistance that they need. Our agency is known for Head Start and Early Head Start, our senior nutrition program. We also have our My Neighborhood group and Grounds for Growth, which are two garden-based community initiatives. If you've ever passed by our location up on Austinburg Road, you might have seen our big hoop house and our huge garden. A couple years ago, we were really good at raising grass and weeds. And since we brought on a garden manager and our Vista volunteer, Julie Wayman, in the last year alone, we have transformed both gardens, the one up at our agency's location on Austinburg Road and the one over on West 58th Street, in what we call our My Neighborhood footprint. And while it's just great to be able to boast the existence of these two gardens, the reasons these two gardens exist is what I want to talk to everyone just for a few moments. The Grounds for Growth garden is an opportunity where nurses, doctors, caregivers, students, anybody who has a volunteer-based mentality can come up to our agency and be a part of the growing operation. So whether that includes weeding, which is not my favorite, or planting, or raking, or painting sticks so we know what's being grown where, or watering, whatever it is, all of the food that we raise there as a collective is donated to the food pantries that we talked about at the beginning part of this conversation. The My Neighborhood garden, which is located on West 58th Street and Madison Avenue in Ashtabula, is an initiative where we invite members of the community who may be in an apartment and maybe don't have the capability or ability to garden on their own to come garden with us. We have raised beds there that are assigned to families and individuals, and everything that they grow, we provide all the seeds, all the water, all of the assistance and the instruction. Everything they grow is theirs, and anything they want to donate, they can. And so we also have a very large part of this garden which is donated or serving as a community garden, and a lot of that food is also then taken to the Dream Center, Geo Ministries, the Salvation Army, Lighthouse Harvest, you name it. So many people are benefiting from these food initiatives, because don't forget, food remains our #1 reason why people call 211. The food insecurity here, we are considered a food desert. Our food insecurity, especially in regards to the children and the elderly, our vulnerable populations, is great. And so these two efforts single-handedly allow our agency and all of the volunteers that make this happen, it allows us to remove some of that insecurity and provide fresh fruits year-round to people who otherwise would not be able to get access to it. It's absolutely fascinating.
So perhaps there's some people out there who are hearing this and saying, I'd like to volunteer.
Mm-hmm.
So they could call 211.
They could dial 211 from their phones and say, hey, I heard about this program. I'd love to join. Who do I talk to? And you will be immediately connected to one of our community development team members. And we'll go over some information, set up a date to meet with you, and get you started on your volunteer journey with our agency.
Very few things in life you can do that are that rewarding.
Right?
Yeah.
It's been truly amazing. Truly.
Fantastic program, I'll tell you.
Before we end, I just wanted to mention, I know you had met or heard of Craig Spar, the director of our Action in Motion Truck Driving Academy. And, we've talked about some of the things that our agency has been a part of, whether through collaboration or by initiating the program itself. The truck driving school was initiated back in July of 2014, and you talk about a program that is truly positively impacting people by providing a real vocational skill and getting people to work. through the grants available through the Department of Job and Family Services, the WIA monies. Individuals who have no income, moderate income, the cost of the class is $5,000. In 30 days, you'll have your CDL, Class A CDL, through this funding that became available in September of 2014. If you meet that 0 to moderate income and some other initial requirements, it's paid for, 100%.
The person comes out the other end and has a good paying job.
Good paying job, and you know, the myth is, oh, to be a truck driver, I have to be on the road and away from my family, and that's absolutely not true. A CDL opens the doors in so many ways. When you see the plow trucks in the winter, CDL. Bus drivers, CDL. Just Google Ashtabula Area City Schools webpage. Look at how many bus drivers they're in need of. You need that CDL. You can drive a taxi, a limo. You can drive for Richmond Transportation, and it can all be local. One beautiful thing about Ashtabula County that I've learned since being back, we are uniquely positioned on a lot of levels with a lot of different meanings, but from a transportation and job perspective, we're so close to 11 and 90 and 20. In 24 hours, you can get to Canada, you can get to Mexico, you can get to the east, west coast, southwest, southeast. We have nurseries, warehouses, logistics companies, trucking companies. You are in the right place, and it is the right time for your CDL. It's absolutely now. There are people looking for people with CDLs, and there are lots of jobs available. And a lot of people may say they're not ready to get their CDL, but they're ready to explore job opportunities. You can also dial 211 for that as well. We have, through that OBB, the Ohio Benefits Bank, we have counselors who are ready to work with individuals one-on-one, to create resumes, to search the Ohio Means Jobs website, really get individuals and family members in their right frame of mind to tackle this thing head on. And most importantly, if our agency doesn't stand for anything, they stand for the fact that people don't have to do it alone. So that's really what I want to get across today. With all of the programs that we have to offer assistance to various and very diverse groups of individuals, households, and families, you're not in this alone. This is Ashtabula County. One beautiful thing, after having lived in New York and coming back to this area, it's a small community, and that can really benefit you when you have the courage to ask for help. You're not going to be alone, and you'll be connected to the right people and they're on the right time. And I just encourage you to dial 211 if you have a question about how to access any of the services we've talked about today.
Remember those 3 numbers, 211.
That's
Very
it.
good. Excellent stuff, Stephanie. I
Thank
appreciate
you.
it.
Thank you.
Yeah, we both really appreciate the opportunity to get this out in front of the public.
We thank you.
Yes.
We thank you. Now,
Now, again, folks, I'm gonna mention Tiffany covered a tremendous amount of information here in this show. It's going to run for a couple of weeks on the local cable channels. But again, I mentioned that in 2 to 3 weeks from now, once I get the file back, this will be posted up on the YouTube channel. So you can watch it there. Just go to YouTube and put in Your Health Matters and my last name. Also, the video file the program is going to be available to Tiffany,
and that'll be up on our website soon as well then. So people can visit. Although the name is really long, Ashtabula County Community Action Agency, our website is really short. It's www.accaa.org, and you'll be able to find a replay of this video right there on our website as well.
Absolutely. So you can go back through it, and there'll be things that she's covered. What did she say about that? You know, and you can go back and then, of course, if you have any questions, you know what to do.
Absolutely.
You dial
211. Yes.
Excellent stuff. All right, folks, that's our edition today. And, of course, we'll be seeing you soon. Have a great week.